Lippy Show. It's the Lippy Show. It's the Lippy Show. It's the Lippy Show, you all. Thank you for coming back and joining me here on bringing in my topics about the mouth. To a degree, I guess you can say I am infatuated with the mouth, but only because it's so important, and it took me only but this long to truly realize how important the mouth was, how it can affect your appearance, your confidence, your health, your gut. What you put in your mouth goes into your gut. If your teeth are destroyed and you have bacteria, you swallow it, it goes into your gut. So the mouth is important. It can alter your way of eating. But that's not why we're here today. We're here today because we want to talk about the major topic that's going on, which is veneers. You know, those things that you put on top of the surface of your teeth to make them appear visually appealing. Is that a phrase? We're talking about veneers. And to begin with, veneers are an excellent solution for fixing chipped, cracked, or broken teeth. It's definitely just first a cosmetic enhancement. It's not medical. A crown is more medical. So when you see a person's tooth and they shave it to those skinny little pieces and people be like, oh, this person's getting veneers. No, actually they're getting a crown, because a crown is there to protect the structure of your tooth that you have left. A veneer is there to enhance the appearance of your tooth. So your teeth may not necessarily be falling out your mouth or completely decayed, but you want them to appear to look better or whiter. That's what a veneer is. And again, a crown is something that if you have a cavity and your teeth have to be shaved down to little to nothing, you have a crown to protect the structure of your tooth. And veneers can, you know, they change the length, size, color, shape, and function of your teeth. And they can basically range in cost from $500 to $2,500 per tooth. And this depends on the material. So that's why when you hear people are like, hey, I just got my whole mouth done for $15,000, $3,000, that's not a lot. $7,000, that's pushing it, because it depends on the type of veneer. There are varieties and types of veneers, and I'm gonna get into that today. But what is most important is to understand that because veneers are a permanent cosmetic enhancement, meaning once you begin this journey, you're gonna have to continue to keep up. You can't just be like, hey, you know what, I'm done with this, I'm gonna take it off my tooth and just wear my teeth again. No, you have to maintain veneers for life. The same way you gotta maintain your teeth. So if you wasn't brushing your teeth, baby, you're definitely gonna have to brush the veneers. You're definitely gonna have to brush the veneers. So for sure, I know you see videos as well where people are getting veneers and the front of their teeth are like, yes, and the back of their teeth are like, what happened? Why are these people placing veneers on damaged teeth? Well, again, let's just reiterate the fact that they're cosmetic. They're not a medical enhancement. So you can go to a cosmetic dentist, as we can see, and have them place a veneer on your teeth. And to a degree, I'm not player hating, but they don't even care about your teeth. They're just trying to give you what you say you want. They don't care if your teeth survives. And that's very hurtful, because we need our teeth. So if you have like gum disease, cavities, enamel erosion, seek to invest in prepping the teeth for a permanent coverage. So what do I mean by that? Again, if you have cavities, if you have gingivitis, if you have periodontal disease, before you begin to get these types of enhancements to your mouth, do some self-care. Invest in your mouth, because if you permanently cover your tooth, you're not going to be able to brush it. And when you can't brush your teeth begin to decay. So why not protect your teeth or prepare your teeth to permanently be covered so that your teeth will continue to hold strong and hold the veneer, because without a tooth, you ain't gonna have a veneer, baby. Without a tooth, there's no veneer. Veneers are placed on the surface of the tooth. Okay, if you don't have a tooth, that's called an implant. If you don't have a tooth, that's called a bridge. So first and foremost, we must protect and take care of the teeth that we have in general. We must protect our gums, our gum line. Your teeth are held in place by your gum line. So flossing, oil pulling, you know what I'm saying? Things like that is what you're gonna want to do. And this is an oil pull from menaturals.net. I just wanted to put this on there. You really can't see it, but yes, this is an infused oil pull with over 10 herbs, beneficial herbs for your gum line. So take a month or two to prep your teeth for veneers. Begin to develop the mandatory twice a day minimum of flossing, brushing, rinsing, and tongue scraping the teeth. And check out menaturals.net What That Mouth Do kit, which includes an oil pull, a toothpaste, a mouthwash, and a tongue scraper. And we also have floss picks, but the moral of the story is begin to prepare your mouth for healthier gums, to place minerals back into your mouth, for a refreshed breath without alcohol, minus disturbing your microbiome, and a clean tongue. Also, make sure that you're choosing a good dentist to ensure that you're a good candidate, because a good dentist is going to say, hey, let's come back, let's reconvene, go take care of this, and then we'll place this on top of your tooth.
And complications occur, like an allergic reaction, gum pain, tooth pain. Your veneer technician is not going to be able to help you because they are not licensed to perform any of the things or tasks that they're trying to perform. That's the reason that we are doctors of dental medicine. Not only do we fix teeth, but we have to fix the whole system if things go wrong.
Dentists typically place veneers over a person's front teeth rather than their molars back here. So that's why you see a lot of people, when you see the front of their teeth, you be like, hey, and in the back, they be trying to keep it up. They be like this. No, open that mouth. What that mouth do? What does that mouth do? So veneers versus crowns. A dental veneer bonds to the front surface of the tooth and is less invasive, thinner, and brittle than a crown, which means it has a higher fracture risk or dislodgement. So I'm sure you've seen those celebrities where they eating and say, oh, what the? And a tooth fall out. All right, y'all know that celebrity what? Ta-gut. Ta-gut. That's the video. And they tooth fall out. And they tooth fall out. Because it's just on the surface of the tooth. And depending on the type, it's delicate and it can fall off. A crown covers the entire tooth. So, because a crown basically looks like a tooth and then it's placed on top of it. You know, it's thicker than a dental veneer and requires more tooth structure to be removed before placement. Unlike veneers, crowns are used for restorative purposes, such as fixing severely decayed or broken teeth. So again, if your teeth aren't severely damaged, have cavities and things of that nature, don't let them take off the thin layers only, or just place it on top of the tooth. And know the difference. And know that you have options. While orthodontic treatment takes longer, it's sometimes the best option for people, especially children, right? Because let me tell you something. I bet not see nobody put no veneer on no child. That's gonna hurt my soul. But yeah, it's not for a child. And this is because braces reposition the teeth and correct the bite without irreversible enamel removal. Orthodontic treatment is more cost efficient than veneers and it averages about half the cost. So if you're looking to have straighter teeth, first consider braces. Get them teeth in a row, okay? Get those aligned first. Save some money. You don't need them to get your teeth straight. Save some money. Now let's get into the top 3 materials for veneers. The top 3. Tres. The top 3 veneers for the teeth. Coming in at number 3, we have composite veneers. And composite veneers are an alternate to porcelain veneers, and they are made from a composite resin, which is a mixture of inorganic and organic materials. And this is the bonding material that is similar to a dental filling. So when you get a cavity and they fill it in with the white filling, like I got some, all right? Composite veneers are not as durable as porcelain veneers. They can also stain more readily over time. And when a composite veneer chips, the chipped area can be repaired and can also be placed directly on the uncut enamel. So I'm liking composite veneer so far as understanding the concept. It's like a filling, and you place it directly on your teeth. You don't have to have a lot of dental or removal, so it's a little safe. I'm feeling it. It usually takes about 1 appointment. You can get them done in the same day. They're sculpted directly onto your teeth instead of being made in a dental laboratory, and they usually last 5 to 7 years. So do consider, if you get a composite veneer, that you have about 5 to 7 years before you have to possibly replace them. Now, coming in at number 2, we have the porcelain veneers. And this is the most common material for veneers. Porcelain veneers are the same color as your natural teeth and is a popular choice due to their durability and their natural appearance. They're versatile and completely customized. They're made of a ceramic material and resist stains better than composite veneers. So this is a buildup. We went from composite, where they're building in on top of your tooth like a filling, a dental filling. And now we have the porcelain veneers, where they are customized. So you probably get a tooth impression. It goes to a dentist. They say, hey, do you like the look of this smile, the way these teeth look? And voila, it usually takes about 2 appointments. But veneers can last 10 to 30 years. 10 to 30 years. I'm feeling like that's the investment is kind of worth it. Maybe a little more expensive, but you don't have to worry about it for 10 to 30 years. Why do they give you a duration of time? Because it depends on how you care for your teeth. Moving forward, let's get to the number 1 type of veneer, which are lumineers. Lumineers. So this is probably where the celebrity area is, because these are the top of the top. They're ultra thin, 0.2 millimeters thin. So we right here with it. It's something like this. I'm just giving. It's something like this. That sounds legit. Let me put this tooth back because I want everybody to have their teeth. Let's put the teeth back. Okay, veneers, the lumineers is a translucent brand of veneers. They replicate the shape and color of natural tooth enamel, and even more so than traditional porcelain veneers. Lumineers are so thin that they do not require tooth reduction or recontouring. What? They're also reversible. What? Although convenient, they can have a greater chance of chipping than traditional veneers, which may shorten their lifespan. So, if you take care of your teeth, it'll last. But If you change your mind, you still got your whole tooth, dang. Okay. Lumineers. Them a little tricky. They may last as long or longer than traditional porcelain veneers. So porcelain veneers last 10 to 30 years. And maybe a luminaire may last, let's say, 20 to 60 years. But guess what? You heard about that celebrity. They paid $100K. Okay? They were not playing. And that's how severe and important and valuable the mouth is, and how you should take it serious. If someone was willing to pay $100K for veneers, and the people are paying $1,300, I'm just saying, you get what you pay for. Common side effects. Let's talk about the side effects of them. So, number one, you may have tooth sensitivity, which is common during the first 3 weeks after you get the veneer placement. If sensitivity lasts longer than 3 months, there is an underlying issue. And I actually seen a video where this girl got her veneers and she got them done once, and then she wanted to get them done again. I guess maybe it was the upkeep, and then now she said that she just has a permanent pain. And people, and the dentist and people think that she's psychologically damaged.
If I could sue, that would be the first thing I'm doing, but I can't do that. It's not possible. Like, can't sue for my sensory issues. My sensory issues are unknown. Every time I go to a doctor, they've never heard of it. And you can't prove that they gave you these issues because there's no way to diagnose it specifically. Like, it's just a whole thing.
They just like, ma'am, where's this pain coming from? We don't see it. So you can have tooth sensitivity. For example, a tooth nerve may have been irreversibly inflamed during the procedure, especially if these preparations are done too close to the nerve. So make sure that you know what you're doing, paying attention to what's going on in your mouth. Make sure you go to a reputable dentist, because now we're getting into the side effects that could be irreversible. You can have tooth damage, which is, though it's less common, it's also a risk of dentine damage after veneer placement. The dentine may suffer damage during the enamel removal process. So when they're prepping your teeth for veneers, somebody could accidentally take off too much of your tooth, and now you got tooth damage. And the moral of the story is that once your teeth are prepped for veneers, they will always need to be covered with a restorative cover. Meaning, once you get veneers, you'll always have veneers. Unless you get lumineers. So please be sure to find a cosmetic dentist that has a great deal of experience installing veneers. Someone you are comfortable with, because getting veneers is a commitment and you want to be happy with the results. And y'all see these people out here going crazy. I went and got my veneers done, and all of a sudden my teeth messed up, and I gotta go to the dentist and get this permanent damage anyway. You should have went to the dentist first. And the dentist could have been like, hey, handle this, and this. Hey, and make sure if they do those veneers, they don't do that, and that.
So I just got off the phone with Smile Design Center, the people who ruined my teeth. I'm going to tag them so they can see this video. I asked them for a refund. I told them I've been in pain for every day for 2 months, which is not a lie. You guys have seen me going to dentists back to back in Los Angeles.
Bacteria can also grow and spread if the veneers aren't bonded correctly by your dentist in the first place. So, when you put that veneer on that tooth, place that puppy all the way down. Make sure they get all the way down. Push that. See? That's what can happen. Make sure they place that tooth all the way down, right? Making sure you have no seals and openings, because that's where the bacteria can grow.
You guys, there's ridges in the back of my teeth. The veneers are not even completely sealed onto my teeth. I had cement left over in the back of my teeth that I had to get drilled off.
Because bacteria is drawn to the gum line. That's why people get periodontitis, gingivitis, and stuff like that. And so, again, when you place these things over your teeth, the only thing that you basically got for real, is your gum line. So you're gonna be, baby, you can still develop gum disease with veneers and tooth decay, which can cause the veneers to break, especially early on. So just because you get veneers, don't mean that you good. Bro, I ain't gotta brush my teeth. I'm just mouthwashing. No. Brush.
I do floss my veneers. I water pick. I use a water pick. I water pick my veneers, then I brush my veneers. No exaggeration, probably 4 or 5 times a day. So everybody has different kind of hygiene, right? Everybody got different hygiene. Some people might brush their veneers once or twice a day, which is crazy. But me, I take care of mine. I brush my teeth like 6 times a day.
Get up in there and brush. Gum infections can occur if the veneers are too large, right? If they're overhanging and bulky, ill-fitted. Bacteria can develop along the gum line and cause gum disease with bleeding, redness of the gums, and swelling, in addition to the battle of the infamous bad breath. I'm about to put a stinky smell here. Bad breath. Let's go, bad breath. Hopefully I was able to get this. But you need to start focusing on that gum line, baby. Flossing, brushing downward, brushing upward, oil pulling. I don't know if you can oil pull. Is it going to loosen the veneer? Either way it goes, if you got a smell in your mouth, go ham on your mouth. Since veneers are covering your natural teeth, you'll need to continue to practice good oral hygiene and dental care to make sure that they last and keep your teeth healthy. If veneers crack or chip, they can't just be repaired. They'll need to be fully replaced in addition to more money spent. So just know, again, that once you get veneers, make sure you constantly putting money to the side, Because if something happens, you gotta fix it. Or
You guys have seen me going to dentists back to back in Los Angeles. I finally found somebody who can redo my veneers. Keep in mind, this will be the 3rd time I'm getting my veneers redone. It's going to cost me $30,000. On top of the already $12,000, $15,000 I've had to spend on my teeth and flying to Miami.
veneers cost a few $1,000s more than you'd pay for a combination of Invisalign and tooth whitening. So if you want your teeth to be white and straight, you can get Invisalign. You can whiten your teeth. And it's cheaper than you getting a veneer that's automatically white placed on your teeth. And though veneers create an instant dramatic result, Invisalign or braces and tooth whitening can resurrect more longevity of the tooth. And this concept flows with investing in the oral care of your teeth. If you place minerals back into your mouth, you will come out with a healthier and whiter smile. So you may have stained teeth and you're like, oh my gosh, invest in your oral care first. Pay attention to the type of toothpaste that you're using. Pay attention to the type of mouthwash that you're using. If you're using oral care, brushing your teeth with coconut oil, just baking soda peroxide, if your teeth are decaying, if the color of your teeth is continuously declining, it's time for a switch. It's time for a switch. And just like any other dental procedure, you should do regular dental visits. So I know a lot of people like to avoid the dentist, but if you get veneers, please go to the dentist. It's always good to go in to know. And I know it's scary. It's scary. At one point in time, I hadn't been to the dentist in so long. Like, it's crazy. But just developing an understanding for the dentist and why the dentist is there, it gave me knowledge on the care of my mouth, what I should do, and how I can maintain and resurrect and protect the teeth that I have. Remember, dental veneers can hide a lot, but they can't completely erase a major underlying dental issue. So again, if you have cavities, periodontal disease, gingivitis, and stuff like that, it's not going to reverse that. It can cover it up. It may be temporary, but the underlying issue still stands. Some of your natural teeth. Just take care of your teeth, man. This veneer thing is just beyond me. In most cases, some of your natural tooth enamel has to be filed down in order to make room for the veneer to fit, which makes veneers irreversible. That's it, y'all. I don't know what else I can really touch on. I've told you the types: composite veneers, porcelain veneers, lumineers. Make sure you're brushing. Make sure you're flossing with the veneers, especially after veneers. Get you a dental appointment, because now you have to focus on your gum line. That's where you're going to have the smells and stuff. Before you get veneers, make sure that you invest in your smile. If you have periodontal disease, gingivitis, try to rectify that. Begin to brush. Begin to floss. Go to a regular dentist to know the condition and state of your mouth prior to going to get cosmetic dentistry, which is what veneers are. As you can see, a lot of people who do veneers do not care. I mean, to me, they don't care because, baby, if I was a dentist, there's no way you're gonna get me to cover up your tooth if I see that you have cavities, gingivitis, or anything like that. I'm not doing it. But hey, what y'all gonna say? You ain't a dentist. I sure ain't. But guess what? I know how to keep my teeth white. I know how to keep them healthy. I know how to protect the ones that I have with What That Mouth Do kit. We're done. You guys have a wonderful day. Like, share, and subscribe. Peace.